welcome to the East Penn Foot and Ankle channel. It's our new channel on YouTube. There's some educational videos here today that are going to explain foot pathology, most common complaints that people have in their feet such as heel pain or plantar fasciitis. We're going to talk about bunions, we'll talk about Achilles tendinitis, and we'll also talk about treatments and surgical management. And on our website you'll also find a lot of information about these type of conditions and treatments as well, and hopefully some information to help you make an educated decision on your foot and ankle health. So today what we're going to talk about is plantar fasciitis, or heel pain, or heel spur syndrome. There's many terms that we can use to talk about plantar fasciitis, but the most common is plantar fasciitis, not heel spur or heel spur syndrome. Well, why is plantar fasciitis such a problem, and what's the cause of plantar fasciitis? Well, basically if you look at the mechanics of the foot, as you walk, you put stress on the plantar fascial band, which is the band that runs from the heel to the tips of your metatarsals right here. That band inserts on the bottom of your foot, maintains the arch of the foot. So what happens is when you step down, you stretch that plantar fascial band, and sometimes you can get some abnormal stress or some micro tears in the fascial band, leading to pain, inflammation, and edema. And the most common site of pain is right here in the medial side of the heel, which is the inside of the heel, and that's where that band inserts, causing the inflammation and the pain to develop at that spot. So once that develops, you'll develop pain when you get out of bed first thing in the morning. The reason being is because when you step down, you stretch that fascial band, and as that stretches, it causes pain on that insertional site where the inflammation and edema is. Some other causes of plantar fasciitis, or what creates the symptoms of plantar fasciitis, are the mechanics of the foot. So some people are flat-footed, meaning their arch collapses as they walk, and you lose that arc. That can cause abnormal stress on the fascial band. Another reason is if you're high arched, meaning that you have a more extensive arch than normal, that can cause stress as well when you step down, causing pain and inflammation at that site of the injury there, which is the micro tears of the fascial band. The second cause is abnormal stress due to prolonged walking, especially on hard concrete floors. If somebody works in a factory or in a department store and they're walking on a hard floor all day, that repetitive stress of pounding on that hard floor can cause irritation of the fascial band, leading to pain and edema. And the last cause is the natural aging process. As you get older, the fascial band can get irritated over time and cause pain and edema. And also sometimes you can get what we call a plantar fascial tear, which is tear in the plantar fascial band anywhere in the back of the heel here, which can cause severe pain. And this is usually caused by an acute onset or immediate onset of pain in the heel, developed from some type of activity such as running or playing tennis, or some high impact sports such as running. So next what we're going to do is we're going to talk about the treatments. Well, how do we treat plantar fasciitis, and what are some common myths about plantar fasciitis?